Thank you for watching Weekend Prime and welcome back. Now, U.S. President Donald Trump issued an executive order calling for a re-evaluation and realignment of United States foreign aid that put a 90-day pause on foreign development assistance. The review period that lapsed on 20th of April has been extended for another 30 days. Has Kenya been able to plug the 30.9 billion shillings funding gap that was left due to the freeze that strained its financial resources for health programs? Gloria Milimo interrogates on this episode of Health Digest.
Kenya is currently caught up in a major financial deficit after the withdrawal of U.S. government funding of crucial sectors. The unprecedented freeze in donor funding has had immediate and far-reaching consequences, undermining decades of progress made in tackling various health challenges. In light of the challenges posed by the U.S. funding freeze, how to plug the 30.9 billion shillings funding gap has left the country in a dilemma. In an attempt to mitigate the challenges born from the order, both tiers of the government embarked on a mission to structure how to fill the financial gap. It was imperative for both governments to formulate ways to sustain crucial health programs that had suffered the hit, according to the Council of Governors Deputy Chair Mutahi Kahiga.
We asked ourselves, for how long are we going to continue walking around with a begging bowl? If you ask me, majority of the counties have done supplementary budgets just to try and see.
The funding cuts caused devastating consequences, resulting in budget shortfalls that forced many programs to downsize, resulting in widespread staff layoff.
We have 2 lines.
This, according to experts, posed a threat to the operations backbone required for consistent healthcare delivery. It in turn necessitated the need to reorganize budgets in order to ensure continuity of service in the health sector.
The panic started with the healthcare workers. So across the country, those who were going to facilities mostly in February and early March were being given medication for 2 weeks, 1 month, because they didn't know where they will get the other stocks. And that then created a panic.
Overall, both tiers of the government required at least 17.4 billion shillings to support human resources for health. Counties say they have so far resorted to redesigning service delivery mechanisms to facilitate the integration of HIV, TB, malaria, and other health programs in order to ensure continuity of services.
We did agree that we were going to retrain and build the capacity of the existing health workforce that we have so that they are able now to support the HIV program.
They also recommended that the National Treasury immediately disburses additional resources to help stabilize disrupted programs, as well develop domestic and alternative funding mechanisms that reduce dependency on external donors.
We also did agree that the Commission of Revenue Allocation would reconsider the revision of the revenue allocation formula to include HIV as a burden, as a parameter to ensure that high burden counties receive adequate resources to sustain the HIV response.
The Ministry of Health had estimated that treatment interruption would result in 58,495 new HIV infections if nothing is done to plug the funding gap. To remedy this, proposal on a comprehensive review of the social health insurance package has been made to expand coverage for critical conditions.
The best strategy to make sure that HIV is treated as a chronic medical condition is to make sure that it is a package of care under SHA. Let them put all this money under SHA, whether that money comes from the Global Fund, whether that money comes from the US government.
Experts in the HIV response space say the government should consider funding HIV treatment in order to ensure continuity of care among the 1.3 million people living with HIV in the country.
I don't think HIV is a very costly affair. I want to assure you that most of those costs are exaggerated. The Kenya government can afford to treat people who have HIV.
Similarly, the stop work order exposed critical vulnerabilities in the country's health data system. The disruption has impaired timely data reporting that in turn impairs disease surveillance, limiting the country's capacity to monitor public health trends and response to crisis. Key platforms such as HIV and AIDS data reporting system, which is crucial in tracking patients' adherence and distribution of ART, Damu KE for blood donation management, Chanjo KE that monitors immunization coverage and vaccine stock levels, Kenya EMR and KHIS2 were affected. Most recently, as part of its foreign aid review, the Trump administration notified Congress of the number of USAID awards it intends to terminate and those it will continue. The list included more than 6,200 awards, of which more than 5,300 were listed as terminated and almost 900 as remaining active. It remains unclear whether the extended 30 days review period by the Trump administration will result in additional cuts or just the opposite. Even so, for countries like Kenya, where foreign aid has been a lifeline, developing domestic and funding mechanisms and investments in local manufacturing of essential drugs and other health commodities is among what experts recommend to help counter the systemic weaknesses caused by heavy reliance on donor funds. Gloria Milimu, KTN.